All right, it is International Hair Loss Awareness Month. Let us discuss medical treatments for hair loss. The ISHRS estimates that since 2021, there's been a 30% increase in patients looking for non-surgical treatments for hair restoration. Now, depending on what kind of hair loss you have will affect the kind of treatment that is right for you. If we're just discussing male and female pattern hair loss, most commonly, we usually tell people to start with topical minoxidil. Minoxidil is a medication that allows vasodilation of the vessels in the scalp, allowing more blood flow to the follicles, allowing for improvement of growth. It is also medication that can be taken orally, but needs to be prescribed by your physician. There's also a medication called Finasteride. Finasteride is an oral medication that is also known as Propecia commercially, and it can be taken predominantly by men or postmenopausal women. The reason we don't prescribe this to women who are, of childbearing age is we're concerned of possible birth defects in male fetuses. But this medication stops the conversion of testosterone to DHT. DHT is essentially the hormone that your follicles on the top of your scalp are sensitive to. So the more sensitive genetically you are to DHT, the more likely the DHT in your body is going to cause you to lose your hair in androgenic alopecia. So stopping that conversion with finasteride helps prevent the sensitivity to your hair follicles and allows for improvements in hair restoration. Now, other things that are non-prescription medications. You have nutraceuticals, right? You have Nutrafol, you have Viviscal. These are essentially vitamins and adaptogens that are formulated in special compounded and patented ways that allow for nutrients to be supplied to your hair follicles, allowing to grow. Key points, these are systemic medications, so there is no guarantee that it will only cause hair growth in the hair. Ladies, it can cause hair growth everywhere, okay? So just keep that in mind. Other treatments you can utilize, PRP therapy, low-level light therapy, and also microneedling. These are all things that we have discussed in prior videos. Feel free to check them out. Now, if you are dealing with a more medical reason for your hair loss, whether it's alopecia areata, which is autoimmune, if it's scarring alopecia, if it is because of an infectious cause of hair loss, it's really important for you to be treated for those things separately. These treatments will not likely work for you in that case, which is why it's important to follow up with your doctor. Let me know in the comments if you have any questions about these treatments, and let's stay learning.